I realized. Hello YouTube, it's me again, Majestic Brown. This is 1 week and 2 days post-op. I had my surgery on March 17th, 2010. I weighed in at the hospital at 305.5, which is 306. I am now, 1 week later, 300 pounds even, which I lost about 5.5 pounds, 6 pounds. Before I went to the hospital, I was actually 300 and, 306, and post-operatively, I had put on 4 pounds. And my bariatric surgeon was wondering, okay, what's going on here? And it's because I was ordered to stop taking my water pill, which is used for my high blood pressure. So for those of you out there who have high blood pressure, make sure you consult with your primary care physician, immensely on that subject, because I retained 4 pounds of water. After I had my first post-operative weigh-in, which was on this Monday that just passed, the 18th, I want to say, 18th, the 22nd, sorry, the 22nd, I was 310 pounds. So he was wondering, what were you eating, what were you doing, were you drinking broth, because his office has 3 phases. Each phase is 2 weeks each. The first phase is liquids, nothing but liquids. You can have 3 protein shakes. He wants me to get in between 60 and 80 grams of protein a day. After my first post-operative weigh-in, he reduced it to 50 grams, I guess, to get that excess weight off, to get back down to at least the weight that I weighed when I was in the hospital. I am now 300 pounds even, once I started my water pill up again. After the operation, I pretty much was really groggy, drowsy. My throat was extremely dry. I had a few videos about that too, and it was really horrible as far as my throat. Everything else was wonderful. I was amazed at how good I felt. I actually didn't have any of that gas pain that I hear a lot of people talk about. I didn't have any of that. I was able to walk on my own. They were actually amazed at how I just was able to just jump up, because, well, I'm pretty sure every hospital, bariatric hospital does this, but after they take you from the recovery room, they take you to your basically your own resting room, I want to call it. And from there, we were required to jump up off of the stretcher and walk into our room. So everybody was bracing themselves, waiting to hold me up and everything. But I pretty much did it myself. I jumped up, I felt a little woozy, but I was able to jump up and walk into the room myself. It was there I realized that how the condition of my throat was dry. It felt like a sock had been pushed down there, and I couldn't get any moisture in. So of course, they give you the water to sip on and everything. And I was kind of amazed because I was able to drink the water. I was really able to drink the water to an extent. I couldn't just sit there and gulp it, but they wanted me to sip every 1 ounce of fluid for 20 minutes. They wanted me to take 20 minutes to drink 1 ounce of fluid, which it didn't work, because I must say they gave me cup upon cup of water, and it was gone before 20 minutes was over. My throat was so dry, I just had to keep wetting it. My incisions afterwards, I could not see them because, of course, they were covered with bandages. I only had 3, which was awesome. Just 3. I was so happy. Most people that I've seen, they have like maybe 5. Some people I've seen 6. And I was like, okay, I can handle that, because this is what I want to do. It wasn't until maybe 2 weeks prior to the operation that I found out that my surgeon only does 3. So I thought, okay, this is awesome, less scarring that I had to deal with. This Monday that just passed, the 22nd of March 2010, I had my bandages removed and the staples removed. And I was kind of scared to move around because I said, okay, without those things there, will I pop back open again or something like that? But I didn't. Everything was awesome. I looked at my scars. I showed everyone my scars. Everyone that I knew, my mom, my sister, my aunt, everyone was like really excited to see them, wondering how bad or gruesome they were. I heal so awesome. I must say, I didn't know that because a few of my friends, they have had a few surgeries, and they have like scars that you can see, and then I'm like, okay, man, I'm thinking that was going to be me. But amazingly, I can hardly see my scars. I'll show them in a little bit. But I must say, everything is awesome. I feel great. I'm not feeling bad about my decision at all. I am really happy. I've been prescribed after the whole fact of the operation. They gave me Lortab, which is an elixir for pain. It's a narcotic, so it really knocks you out. I was also subscribed a medication for nausea, which was called Compazine. Okay, it was a suppository. Being that, of course I have the band, they wouldn't want me swallowing any pills. So they subscribed me a suppository. For those of you who may not know what a suppository is, it is something, I'll show you. It is kind of like a torpedo type thing, and you're supposed to stick it in your rectum, up into your rectum. And I wasn't absolutely sure how suppositories work until I talked to a nurse, and it just snapped. I said, okay, the medication is within each of these torpedo things, which is inside these little capsules. Of course, you have to pop it open and take the suppository out and stick it in your rectum. I didn't need it. I didn't feel any nausea. The most I felt was a little pain at the incision site, which is where my port is lying under. That's the only pain I felt. But the suppositories, I guess they'll come in handy maybe sometime down the road. I don't need them now. I was happy I didn't need them now because I wasn't really fond of sticking anything in my bum, So these will be held for later sometime. I have also been prescribed potassium because prior to my operation, my potassium level was low due to me taking my hydrochlorothiazide. And the preoperative diet, which was only the protein drinks. With the protein drinks, I wasn't getting enough nutrients that I needed as far as the potassium goes. So with me taking just the protein drinks and water, juices, and stuff like that, I wasn't bringing in enough potassium. So prior to me going to the operating room, they had to take my blood to make sure that my potassium level wasn't at an extreme low. My doctor prescribed me potassium prior to the operation, but I didn't get it filled. So the day of the operation, he asked, okay, Tiffany, have you been taking your potassium? I said, well, actually, I have not. The nurse told me to just drink orange juice, so I've been drinking orange juice prior to, and he kind of got mad at me, and said, but I told you to take it, you were supposed to take it before, we might have to cancel your operation. So I guess he thought he was going to make me mad, and I said, okay, if it has to go that way, it has to go that way. So